Hi, welcome back. This is part of our series on preparing for surgery and recovery from surgery for your pet, specifically with cranial cruciate ligament injuries and TPLO surgery. This is just a quick series of videos on postoperative passive range of motion. My name is Amy Lamoureux-Hesbach. I'm a physical therapist and canine rehabilitation practitioner and therapist in Maynard, Massachusetts. I do home visits, but I also do online consultations and educational sessions for pet owners, as well as pet physical therapy and rehabilitation practitioners, both here in the US as well as worldwide. So the most important thing about doing passive range of motion, or PROM, is to be comfortable. So you need to be comfortable, your pet needs to be comfortable, the environment that you're in needs to be comfortable, your hands need to be comfortable. Your job is to flex and extend, to bend and straighten each of the joints of your pet's limb. If your pet has had knee surgery, hip surgery, ankle surgery, that's all in the back leg. These are all the joints that you need to take through a comfortable range of motion. If your pet is resistant, if they're uncomfortable, if you are uncomfortable, if you are stressed and anxious, then it won't go very well. So the key is to stay relaxed, comfortable, and try to keep it as positive a situation for you and for your pet. So my advice for you is to keep your position comfortable and close to your pet. So sitting down on the floor if you're able, near your pet, where your pet is resting. You can introduce your hands in a relaxed way, both above and below the joint that you are taking through the range of motion. You may want to start with some some massage or some petting activities to help your pet relax, to introduce your touch again to your pet. Again, we want to keep it non-threatening, non-stressful, non-painful for both you and for your pet. Bending and flexing are the same thing. Extending and straightening are the same thing. Looking at each of the joints of the body, the hip is here. It's kind of that bump on the side of the back leg. The knee is here, further down. That's also called the stifle. And then the tarsus or the hock or the ankle is further down. If you can imagine, your pet is standing on his tiptoes. So his heel is up in the air. When doing passive range of motion, my suggestion is to do 10 to 25 repetitions, slowly, predictably, 2 to 3 times a day, especially early in the recovery stage after surgery or injury. Again, keeping it comfortable, keeping the range of motion that you're utilizing comfortable for your pet. We do not want this to be a negative experience for either of you. So just in general, these are some videos that are maybe more real life, less than ideal. So when doing passive range of motion to the hip, ideally we want the pet to be lying down on the floor, on the ground. Sometimes they're willing and sometimes they're not. So can they do some of that range of motion themselves? Can we stroke the muscle along the front of the leg or stroke the belly to get the pet to extend the leg on his or her own? Some pets are not going to want to lie down, and so we might have to do that range of motion in a standing position. We want to support the pet, want to gently extend and then flex, not forcibly. Go through that range of motion slowly and carefully. When doing passive range of motion to the stifle or the knee, we're again going to flex and extend. And by flexing and extending the knee or the stifle, we might actually have to flex and extend the hip and the ankle. This is because the muscles extend from one joint to the other. So there are connections that are being made where going through full range of motion is going to require movement at another joint as well. In the same way, some pets will tolerate standing, some will tolerate lying down. So introducing this again in a positive, comfortable way for your pet, allowing them to have some control, is going to be safe for you as well as for your pet, and keep it a positive experience. So you can see how my hands are close to the joint. I'm allowing the pet to do what she's able to do. I'm giving her some support. I'm not forcing the range of motion. And then finally, the tarsus or the ankle. So this is the most distal joint or furthest away from the hip. And we might gently flex and extend. And you can see this little lady is not too keen to doing this range of motion. We're accomplishing what we're able. And we might do it again in lying or in standing. You'll find that to flex and extend the ankle, you actually have to allow the knee and the hip to flex as well. So when the pet does not want to cooperate, and this happens a lot, especially when you're the owner and you're putting your hands on. So sometimes we have to let that pet move as best they can in a positive, comfortable way. And that might mean giving them a belly rub, allowing them to roll a little bit on the floor, maybe stroking our hands along their legs, along their body, to just get some active range of motion from that pet and through their body. This might be the best way to introduce that hands-on passive range of motion, and it might be the best way for this activity to be comfortable and positive for you as well as for your pet. If you have questions about doing passive range of motion with your pet, my suggestion to you is A, contact your veterinarian or veterinary surgeon. B, contact a pet physical therapy and rehabilitation practitioner. So this might be a veterinarian nurse or technician. This might be a physical therapist with certification and education in animal rehabilitation techniques. Have them demonstrate on your pet, have them teach you what to do, and again, keep it positive, keep it comfortable. This should be a happy, good experience for all of you. We don't want your pet to be hurt. We don't want you to be hurt. If you have any further questions or are looking for further resources, I'm happy to connect you to a clinician or practitioner near you. My contact information is listed below. You can contact me by email, through social media, through my website, through my Teachable site as well. And I hope that you tune in to some other videos that we have posted here that will help you best prepare yourself and your pet for that post-operative recovery period. Thanks and have a great day.